Yeah, Caribbean Fever 107.5 WBLS, Dahved Levy rocking you. Let me see if I have my another special guest on the line. Hello, good evening.
Hello.
Hi, how are you doing?
I'm doing well, Dad.
Okay, can you hear me? Can you hear me well?
I can hear you. I can hear you well. Can you hear me?
I can hear you well, too. So, ladies and gentlemen, we've got the chair of emergency medicine at the Brooklyn Hospital in downtown Brooklyn, Dr. Souza. Dr. Souza, welcome to Caribbean Fever 107.5 WBLS. How are you doing?
Thank you for having me. I'm doing well.
Okay. I don't know if you were listening. Have you been listening? And did you hear that?
I've been listening.
Uh-huh.
I've been listening, and the first thing I want to say is I want to wish a full recovery to Mrs. Gardner, who was on your show earlier on.
Mm-hmm.
I want to also applaud Borough President Erica Adams for distributing masks in our community.
Mm-hmm.
And the other thing I wanted to mention, that your choice of song after Mrs. Gardner came on, by Bob Marley, is actually the song we've chosen to play in our hospital every time a patient recovers and is discharged.
Are you
from the
serious?
hospital.
Are you serious?
Yes.
Then a patient, well, hold on for a second. No. Then the patient recovers and is discharged from your hospital. You play Bob Marley's song.
That's correct.
Wow.
That's correct. And that's the song we actually picked out of all his songs. So it's not a coincidence, I think. And I wanted to mention that.
Okay. So let's get into it, Dr. Souza. Dr. Souza, you are our chair of emergency medicine for Brooklyn Hospital. What exactly does that mean?
That means I'm in charge of the operations in the emergency department, in the ER, as it's known in the community.
Mm-hmm.
We have a team of physicians, we have nurses, we have residents in training, and a whole host of support staff, clerks, respiratory therapists, registration staff. So pretty much I'm the one who's leading the way for all these this operation in the emergency department.
So are you a leader that's down there on the ground with them, or you're a leader that's sitting up in the office someplace?
Well, I'm glad you asked. I think the most important thing is to be down in the trenches with your team. I think emergency medicine is a team sport, and you have to lead by example. So my team and all my colleagues are my heroes, and not only my colleagues, but they're my heroes today.
Okay, so you are at the front line. You are there when a person comes into the hospital. You are dealing with them, and you're not only dealing now with coronavirus patients. You're dealing all the other symptoms that has been going on all this time is still coming in, right? So you're dealing with all the things that happen, and also coronavirus is an added thing that's added to the situation right now. How has it been going thus far for you at your hospital?
Well, I can tell you, David, we started preparing for this. We've been preparing for this for our whole life. I think the H1N1 crisis really sort of gave us a training of sorts, but I don't think any of us were prepared to the magnitude of this epidemic. But since March 3rd, what we've been doing, we started screening even before any sort of clear recommendations came out. We started screening because we were watching what was going around in the country and around the world. And at that time, we saw a few patients, and there hadn't been a single death in New York State. The next day, we had the first death.
Right.
But by that time, we already had put a whole system in place in order to screen patients, to also prepare our emergency department to increase capacity, to divide our emergency department to receive not only the patients who are having COVID symptoms, coronavirus symptoms, but also to take care of all the emergency that we would normally see, like strokes, heart attacks, in order to protect those patients who were not yet known to be infected. Mm-hmm. So that was a challenge in the beginning, but we were able to meet that challenge.
Now, it has been brought to my attention that the hospital that you are at, that you guys haven't run out of face mask, or you haven't run out of the necessary things that you would need in working in the hospital. Why is that? Why we hear a lot of hospitals don't have it? We have heard that nurses be using the same mask for every day for 2 weeks. We have heard some hospitals nurses don't even have masks at all. What makes you so different from the others?
I think, David, what's made the difference is that we are a community hospital. We serve the same community year after year, and there have been days where we came very close to running out, but we have been very blessed by the support of the entire community, multiple donations from multiple sources. So while we were waiting for supplies from the Office of Emergency Management, we were able to accommodate everyone and protect the entire staff through donations that were vetted through our supply chain. So in that sense, we're extremely blessed, because of what we do for the community. Essentially, we're not a large center with lots of resources, but we have a lot of heart, and we have the support of the community.
Wow. So the community is doing a lot to give back to the hospital, because that community might even end up going to that hospital.
Absolutely. We see our regular patients come to the our doors, and they know we're there for them.
There's a lot of talk going on about blood plasma these days. That we heard that a patient could have, when they get over this thing, the plasma in the blood could be used now to work against the coronavirus. How far are we with that? And do we have enough blood plasma now that it can affect the patients there in a positive way? And how long does it take after a person is sick that this blood plasma could be used?
Well, there have been many treatments out there that have been tried, and with various degrees of success. None of them have proven benefits yet. But I'm very happy to say that last Friday, we were able to actually have 4 patients be the recipients of plasma. And to explain it a little bit, it's basically plasma that's collected from patients who have had the disease, who have donated their plasma. And we've been able to utilize that plasma because it contains antibodies to fight the disease on some of our sickest patients. We are doing this in collaboration with the New York Blood Center, who has been instrumental in making this happen. So we don't know yet we don't have enough information to yet make a decision on the effects, but it's certainly the most promising treatment we have thus far.
Has there, based on information that you may have gathered or may not have gathered, are we close to something that can stop this virus? Are we close to a pill, a tablet, anything? Go ahead.
Mm-hmm. Mm-hmm. I think there is no magic pill, unfortunately. I don't think it's out there. I think the most promising treatment we have right now is the plasma of folks who have recovered from the illness. I think researchers are working very hard on other antiviral medications, which may or may not have an effect, and a vaccine, of course. We're all waiting for the vaccine, sure.
So I've heard that in France there's some kind of hexachloride, something like that they've tested on 80 people and on 90 people, and 87 people came through. Is that factual, or that's just stuff that's out there?
It's a fact that it's a medication that is being used in France. It was from a professor in the south of France who is using chloroquine, which is a medication you usually use for malaria, in combination with an antibiotic that we use here commonly for bronchitis and other infections. However, there's not enough evidence to say that it is a proven treatment.
Okay.
However, when you have nothing else available, you give it a try. So it has been used, here, including in our hospital on the sickest patients when they present, just because of the lack of having anything else. Those patients are carefully selected, obviously, but we need more data, more studies to see whether it has any proven benefit.
Mm-hmm. Wow. Caribbean Fever 107.5 WBLS. We have Dr. Souza here. She is the chair of emergency medicine at the Brooklyn Hospital. We're going to take a short break. Dr. Souza, please hang on. Don't go anywhere. Caribbean Fever
sure
107.5 WBLS.
I'm still here.
Okay.
Still here.
So, doctor, we've been hearing a lot about the people on the front line. And some people on the front line have not been faring too well. You said that you're down the trenches with your fellow nurses and doctors. How do you feel knowing that there is a possibility that the same virus that you're trying to get rid of from your patient is the same virus that you can end up with? What kind of mindset do you go to work with every day dealing with patients coming into your emergency ward?
I mean, clearly there's fear there, and there's the fear is not so much for ourselves, but it's for our families, bringing the virus back home to our families, our children, our loved ones, who are more vulnerable, the elderly, those of us who have parents, who are taking care of parents. So it's real. This is our calling. So this is what we've been trained for and preparing for our entire life. So we show up. Some of us have fallen ill and have gotten better and gone right back to work.
Are you serious? So you've had doctors and nurses that have gotten ill, recovered, and went straight back in the battlefield.
Absolutely, and
wow.
This is when I was saying they are heroes. I meant that. They just show up. They keep showing up. We've had also a lot of volunteers from the Medical Reserve Corps show up, and I applaud them. Like I've gained a whole new respect for my coworkers. As I said, they're my heroes because in spite of the fear of what they can take home, they still show up for work to care for the sick ones, to comfort them, to counsel them. Eric Adams spoke about speaking to people at a level they can understand. I mean, our saddest moments is having to speak to families whose loved one is not doing well. And unfortunately, those families cannot enter the hospital because we have to protect them from infection. So it has been a challenge. So we're the intermediaries, right?
I want to jump in very quickly. So just that people can know, the reason why families cannot enter into the hospital to see their loved ones is why? What is the main reason for that?
The main reason is to protect them from infection themselves.
Right.
Those who are not infected really would run a risk by just entering the hospital, no matter how much PPE they're wearing. PPE protects you, but it's not 100%. So that's the main reason. It's to try to protect them, and also to try to protect them from going back out of the hospital and spreading the disease in the community. So we make arrangements. We try, as much as we can to have them communicate with their loved ones. We use video monitors and all sorts of other ways to communicate as much as we can. But it has been the most challenging part, the isolation of those who are critically ill, who don't fare well.
So have you had to endure one of your soldiers not making it?
Unfortunately, that's something we have been faced with. Yes.
Wow. Like
every hospital in New York City, unfortunately, that's been the case, and not just in our hospital, but I have many colleagues in emergency medicine who have not done well, and some of them have succumbed. So it is a reality for us. Every day we go to work, we have this in the back of our mind. We have to overcome that fear and just get into the mode where we have to be there for others, because that's what our calling is. That's the oath we took.
Mhm.
So we're there 24/7.
Well, let's talk about what it takes to sanitize oneself. The best protection that a person can give themselves. Can you go through maybe your regimen? What do you do?
Well, for me, it's a little different because I obviously my exposure is greater. It's all day long, all during an entire shift, and it's multiple exposures.
Hmm.
So for all of us, the healthcare workers, I think our routine is the same. We leave our shoes outside. We completely disrobe when we get home, and we jump into the shower.
Hmm.
And at home, a lot of us completely isolate ourselves, whether or not we're exhibiting symptoms of the disease. We just isolate ourselves from the rest of our families to protect them. So
Mm.
I think that's the routine of every healthcare worker, frontline worker. I'm sure that it is because of our concerns for our loved ones. For now, the rest of the public and the community, those who can stay home, please stay home. It's easy to say. Unfortunately, not everyone has the luxury of self-isolating, has an extra room to self-isolate at home. However, we still have to make that recommendation. We give out a mask to everyone who presents to the hospital for screening or treatment. Practice social distancing is very important, and remain hopeful. That's really my recommendation. Washing hands, obviously, is key as well, but the social distancing is what's going to make the difference. I really, truly believe that.
Now, it seems like a lot of opportunities have been opened now for travel nurses and travel doctors, and so it this bad thing has presented a good thing, and work for nurses, work for doctors, and I understand now that a nurse can make a lot of money when the week come.
That's
Is your hospital looking for nurses and doctors?
At this time we're not, because we've been blessed to have the medical reserve corps, which has been it's actually a division of the Department of Health that is entirely comprised of volunteers, healthcare volunteers, and it was formed after 9/11 to fulfill this need of in the event of a disaster. And you'd be amazed. You have people who work their full-time job, and on their days off or after hours, come and volunteer their times to be in the front lines, taking care of the sick. So we have not had a need for travel nurses, travel physicians. And once again, we've been extremely blessed to have those volunteers. I'm actually myself part of the Medical Reserve Corps, so I know the value of all those who volunteer, and we've their work is amazing. Their sacrifice is amazing.
Well, Doc, I know you might have to get to work early in the morning. I want to thank you very much for sharing your time with us. Any closing words from you, Dr. Souza?
Once again, stay home, wear your mask, practice social distancing, and remain hopeful. I did start, a movement to encourage all the frontline workers. It's healthcare worker shout out at 7 p.m. and it's gained some momentum. So, if you're free at 7 p.m., just get out there and encourage all those who sacrifice their own health or safety to help others. That's really my closing statements. Thank you for having me.
And thank you very much for lending your time with us. I do appreciate it. Okay?
Thank you.
Thank you.
Bye. Bye, David.
Bye. Caribbean Fever 107.5 WBLS. Let's go. Yeah. Caribbean Fever 107.5 WBLS. Wow. We've got artists to come too. We got a lot of stuff going on tonight. I tell you, I'm not playing around. I am not playing around. Caribbean Fever 107.5 WBLS. Dahved Levy, rock you now. Let's go to another phone again, another line. Hello, good night. Who's this?
This is Pamela Bradley.
Hi, Miss Bradley. How are you doing? We've got the former principal of the Department of Education and now CEO of PRB Consultants. Am I correct?
That's correct. Thank you for having me.
How are you doing? So I wanted to get a perspective now. We've had doctors on. We've got everybody on. We've got politicians on. I want to get a person who has worked with these kids, been a principal of one of these schools, and have worked and is now doing something unique because there's not one size does not fit all the kids, right? Different kids
That's
need
correct.
different things. So this is why I guess you're now doing this PRB consultation. Let's talk a little bit though about the kids in school. Everybody now is talking about it's out there that they will have the rest of the term off. From your advantage point, is that a good idea, a bad idea, or maybe it's the only idea that you can use at this point in time?
Well, when you're thinking of the safety concern, we understand where that's coming from, but we know the impact that it's going to have on students, especially students in underserved communities or low-income communities like Brownsville, East New York. So on one hand, yes, we want children to be safe. The concern is how do we help kids during this period make sufficient progress for next year.
So what do you think can be done? What would you do that we can get our kids that are brown and black that live in these areas to be up to par and be able to compete with the kids from all around the world, the other kids from all around the world?
Well, that's a great point, David. One of the things I do want to say is we know that students in those communities are already significantly behind their peers. And so I know the Department of Education is doing their best to try to get online learning up. A lot of these scholars need one-on-one tutoring. They need more than what is currently being offered. I've spoken to a lot of my clients who are struggling with the online platform, so a lot of their kids are not getting the education they need. A lot of the parents do not have the skill set to support the kids, whether it's the technology aspect of it or whether it's the academic aspect of it. So at this point in time, the question becomes, how do you then give the scholars more support? And companies like mine that do one-on-one tutoring, virtual tutoring, would be needed for a lot of scholars who are struggling. Whether the Department of Education can provide that is a different thing.
Well, in the workplace, things have changed. Everybody is on Zoom, right? So I'm trying to figure out, well, I figure that if in the workplace everybody is on Zoom, in the school scenario, everybody should be on Zoom too. But then it was brought to my attention earlier today that you might have a lot of families that might not even have a computer to be able to do. Some people might not have internet or access to the internet. I mean, how prevalent is that reality?
So on the news today, they were talking about 70,000 computers or iPads will be distributed by the end of April, which means that families that do not currently have the technology will have to wait until the end of April to even start working with those online platforms. Some of the problems I'm facing with a lot of my clients, what their complaints are, is when they have multiple children in the home and only have one computer, and you have 4 scholars in 4 different grades.
I never thought about that.
How do you then help the scholars at that? The other thing is I know this one case of a teacher who I've been speaking to where the scholar doesn't have the mother's account for internet is out, so the scholar doesn't have access to internet. So that becomes another major issue. And I know that they're trying to look for provisions and ways around that, but it's an issue that students in underserved communities and brown and black communities are really facing at this point in time.
Some people are saying, that this is a bad scenario to be in because now it's going to change the way that education has been presented for the rest of our lives. So we will never, the fact that people are now staying home and working on the internet and kids are now learning, but there's no other choice but to learn and communicate with their teachers on the internet, that moving forward, we are going to see more of this instead of the brick and mortar. Do you agree with that?
I think that's going to be a devastation for children of color in particular, who really work more on relationships than on an object-oriented type of learning like that's offered through a computer. I think in the meantime, it's a Band-Aid in order to move the scholars forward. One of the things that we do know in education is that there's something usually called the summer slide, which means over the summer months when scholars do not have access to their classrooms and their teachers, there's a regression that happens. They lose some of the information they learned during the school year. And so one of the major concerns that we're facing in this new dilemma is what happens with that summer slide. If you're talking about scholars losing 1 or 2 reading levels over the summer, what happens between now which has been the end of March to next September for these scholars. And no, I do not think online education is a Band-Aid, but it's not. It certainly cannot be a long-term fix.
Wow. Caribbean Fever 107.5 WBLS, Dahved Levy rocking you. We're talking to Miss Pamela Bradley, former principal of the Department of EDU of Education and CEO of PRB Consulting. What is PRB Consultants doing different that you don't get in the classroom?
Well, right now, what we're offering is, and of course, again, it's not the ideal. Normally, what we created ourselves to go into communities where parents normally would not seek tutoring, so we go to them. We bring it to underserved communities that normally do not get tutoring services. But what's making the difference now is we're offering that service one-on-one. So one of the issues with classrooms, with the Zoom, some classes are using Zoom, a lot of classes are using Google Classroom, and some are using a combination. But what we're doing is that child's individual needs are met. So they're interacting with one of our teachers directly, specifically on things that particular scholar is struggling with. Classroom teachers, DOE, and charter schools cannot do that. They have 30-some kids that they're trying to educate at the same time. We are able to go specifically to kids, knowing their needs because we've assessed them and really tailor their learning to them specifically. Every child, and this is the thing that I think has been a thought, but it's been very hard to implement in DOE, every child needs what's called an individual educational plan. And unfortunately, because of class size, that just doesn't often happen. Most kids with IEPs are kids that have special needs. And that's another population that is truly at a disadvantage for this during this time, because there are the scholars that may have ADHD. They cannot sit in front of a computer for 4 hours. And the parents are complaining that, it's a hard time to get these scholars focused. They need a one-on-one para. They need the support of a special ed teacher as they're trying to acquire this new knowledge.
Wow. That's man. This is not easy. This is not going to be an easy fix or easy Band-Aid to put on. And you made a very good point when you said that different kids, different strokes for different folks. This kid might have this problem, that other kid might have that problem. So you got to reach them individually. And when they're in a classroom looking at a screen, I can hardly look at a screen now for an hour or two. Furthermore, being a kid glued to a screen for 4 hours, I can understand how frustrating that can become. And the kid losing interest, just staring at the screen, and might not be even computing what is coming on the screen.
And David, if it was just 4 hours, I think, and it could be broken up over time, that's one thing. I have one scholar, these scholars are in charter schools, where they're there from 8 o'clock in the morning to 4:30. They get a break at lunch, but they're following their regular school day, but via computer. Mm-hmm. You're also talking about scholars who are struggling in reading, and you have something like on Google Classroom where they have to read the assignments or they can watch some videos. But if they're already struggling in reading, how do you expect them to read on a computer when they can't do it, independently themselves?
Wow. Very, very good point. That's why we have you on, because we understand that you have done this before from the end of the Department of Education. Now you're doing it in a different way. Ms. Bradley, thank you very much for coming on with us. We're very appreciative. Thank you very much for rocking. Any closing words you wanted to say?
I want to say just encouragement to parents who are it's parents and teachers. I think both are doing a great job, but encouraging the parents that, yes, you can continue to support, reach out to folks in your community that may be able to do a Zoom conference with your kids. That's where I would say in the closing remark.
Okay, thank you very much. Caribbean Fever 107.5 WBLS. We're taking a short break. We come right back after this.